There's something also very personal in your book that you include before you jump into menopause in a nutshell, which is that your mother and your mother-in-law started taking hormones in their late 80s and had a
Yes, they did.
profound result. And the reason this is so important is that a lot of people don't put this in the right context. Their health is declining, they're losing mobility. The things they love to do are becoming inaccessible to them. They're not able to even relate to their families cognitively, forgetting people's names, forgetting birthdays, forgetting special moments, not being able to recall anything short term or long term. And they're worried about cancer when their life is slipping away. We have to put these things in perspective, because a lot of those problems, this slipping into debility and old age, can be in some cases dramatically reversed with hormones. Is that fair, Dr. Rosensweet?
It's very fair. And like, for example, we have on our medical board a physician that spent a lot of her early career being the doctor for nursing homes. And I once asked her, what percentage of women and men in nursing homes do you think are there because of low hormones? She said 80.
Whoa.
Yeah, you lose your androgens, you lose your muscles, you develop sarcopenia, loss of muscle. You move from cane to walker to wheelchair. That's very definitive, that change, walker to wheelchair. You lose your ability to hold your bladder to function properly. You're in adult diapers. And so many of these folks are losing cognition. And although let's take women, every case of cognitive decline is not related to hormones. A lot of them are. And of the women who show up in my office in early menopause, and by the way, the earlier that you get or start addressing this stuff, the better. Yes, we treat anyone of any age, but much better to start with the perimenopause or midlife for men too. It's much easier to sustain something than to recover it. You can recover stuff in later age, but it's not ideal.
It's you have to be far more consistent. You have to be far more dedicated, detail oriented. It is so much easier to address this when you're younger.
So these hormones are the most powerful biochemicals in our body.
Without a doubt.
Their loss is tremendously consequential.
Would you tell us the story of your mother and mother-in-law?
Yeah, my mother-in-law was on her third heart attack, a third bypass.
Ooh, so that's not just, it's third open heart surgery.
Well, coronary bypass, open chest surgery for sure. They're replacing coronary arteries. And she had developed really a significant sarcopenia. So she had moved from the cane to the walker, and then she was standing in her kitchen, and she turned because of her instability. She fell on her tile floor, and she fractured her humerus and her clavicle and her pelvis, and was in rehab for 3 months. And it all dated back to what a gerontologist told us senior medical students in 1968. They said, you folks know a lot of diagnoses. You're University of Michigan senior medical students. Let me tell you what's really happening to old people. They're losing their muscle. They can't stand and walk with stability. They fall on their osteoporotic bones, and they die from a fracture of the hip. And or they're losing their mind, and they can no longer function with their families. So what was back to what your focus is, this is big fun for me, by the way, Leland, to talk to a real comrade in arms here. This is what happens to old people. People in their 50s, 60s, they don't often think about, well, what's my life going to be? Yes, I had to assist my mom into the nursing home, but that'll never happen to me. Or they're not thinking this clearly.
There's a denial.
Yeah. And, most people, very often, we're just paying attention to what's really right there in our face. What am I doing today? And all this stuff is so consequential. To lose your muscles because you lost your androgens, to lose your mind because you can't think clearly, and women to lose their vagina, men to lose their erection, lose your bones, lose your arteries. That's how powerful these hormones are. Whereas replenishing of them is a sweet process. It's a process, not that hard. And so it's a big deal. It can really make a difference in staying at home for your whole rest of your life, and walking and talking and thinking, which I find everyone wants to do.
How about that?
Rocket surgery, right? I find when an elderly person is facing the reality that they're entering into a assisted living facility, it's a shocker when the family can no longer take care of them at home. And so much of that is our doctor says 80% of them, this is preventable. Yeah, there's some dementias that go way beyond just hormones.
Sure. But any case of cognitive decline in the practice, hormone optimization is something that we urge patients to pursue, at least be open to. And frequently our progress with them is it's slow when they're not willing to try a full protocol for hormone replacement, because they all play a role and you cannot get by on just one or two. We had the question the other day on a webinar: if you were going to recommend only one hormone to replace, what would it be? But, and Lauren, our nurse practitioner, said, you really can't ask this question and have us give you a clear, strong answer, because there's this symphony of these hormones going on. To the clinician who uses them, it's something of a tragedy to only want one.
That's beautiful.
Yeah. But
Great
what was
insight.
the result with your mother and mother-in-law, if you don't mind my asking?
Well, my mother-in-law, we have a video of my mother-in-law about 3 months after rehab, when I started replenishing hormones for her. She's sitting on a low couch, one of those low leather couches. She's got her arms outstretched, and she stands up without using her hands. That was dramatic. We also have a video of my mother, who was walking with a cane, walk with the cane and then set the cane down and walk towards us without the cane. This was a very big deal for her.
Of course.
Yeah. So yeah, they're powerful, they're dramatic, they're not everything,
No, they're not
but
everything.
but they're a big deal.
Absolutely. They could. Well, that's, I think, part of why there was such a concerted effort to discredit them intellectually, which hasn't really been borne out in the literature, as you've mentioned and document in your book, and as we're going to go over in Estrogen Matters next week.
In a couple weeks, but yes.
Oh, was it a couple weeks?